I was recording this at home today and I've got no pet with me because what we're talking about today is all about your dog's poop. So, because poop can really foretell health problems. So let's start off with the topic of acute diarrhea in dogs. Acute means bang, sudden onset. So occasional episodes of diarrhea are to be expected if you have a dog in the family. They are totally, completely and utterly normal. And that's the way the dog's gut has been designed over time. So that's okay, don't worry about it. There are many, many potential causes of diarrhea in dogs, but the most common cause by far is what we call dietary indiscretion. In other words, eating the wrong thing, garbage guts, eating the compost, those sorts of things. Diarrhea comes in many forms, and you can sometimes tell the cause of the diarrhea by the appearance of the stool itself. Diarrhea symptoms include not only explosive, loose, watery stools, but also a dog that's hunched, a dog that's straining, and a dog that looks constipated. And we see so many dogs come in and the client rings up and says, my dog's constipated, I need to bring it in. And the dog comes in and it's not constipated at all. It's actually straining because it has severe diarrhea. So that's a trap for young players as well. Now, home care for a bout of diarrhea in an otherwise healthy dog, I'm quite okay with you doing home care for a case of diarrhea, but just do it for 24 hours. If there's no improvement in 24 hours, then you need to come in and see us. So a common home care scenario would be a short fast, maybe 12 hours, and then a bland diet for another 24 hours. And you can always throw in some probiotics as well, dog probiotics, of course. If that works, which it will do in a lot of cases, fantastic. If not, you really need to come in and see us. Now, if you're a dog parent, I'm sure you'll be aware that occasional episodes of diarrhea simply go with the territory, as you said right up front. It's never a matter of if your dog is going to have diarrhea, it's a matter of when your dog's going to have diarrhea. In fact, anticipating random loose stools and knowing how to manage the situation like we just talked about is just a part of being a prepared dog parent. Diarrhea in dogs can have many, many potential causes, and they can range from benign to very, very, very serious. So, dietary indiscretions we've talked about. Dietary changes we've talked about. Dogs get irritable bowel disease. Dogs can also get inflammatory bowel disease. Dogs can get pancreatic insufficiency where they'll have diarrhea. Dogs can have bowel cancer. Dogs can have food intolerance, food sensitivity, or food allergies. They can have intestinal obstruction. And yes, with a blocked bowel, for some part of the disease process, they will have diarrhea. So just because they have diarrhea doesn't mean that they're not blocked, if that sort of makes sense. There's another disease called lymphangiectasia. Dogs can also get colitis. Colitis is an inflammation of the large colon, of the last 30 to 45 centimetres of the bowel. And there's all sorts of different forms of colitis. They can eat or ingest toxins or poisons that they just happen to have found lying around. Intestinal parasites will cause diarrhea. So these are things like Giardia, these are viruses, these are bacteria. Dogs also get rectal polyps or colonic polyps, just like we do and we get examined for. Now, dogs also get what's called HGE, hemorrhagic gastroenteritis. Parvovirus is a form of HGE. In HGE, hemorrhagic gastroenteritis, a dog will have bloody diarrhea and often vomit blood as well. So, dogs also get histoplasmosis. So I've just listed a whole heap of things there, and I've got a handout with all these things on them. So please feel free to call us and we'll send you the handout. Now, by far the most common cause of diarrhea in a dog that's otherwise healthy is indiscriminate eating. Things like sticks, rocks, socks, toys, those sorts of things. So if your dog has diarrhea, that's one of the first things to look at, especially in puppies. Now let's talk about types of diarrhea. The watchword in all cases of diarrhea is caution, okay? Caution. It's really, really important to call us earlier rather than later. Earlier, we've got so many more things to do. Later, we're down the very pointy end of a narrow funnel, and treatment options can sometimes be very limited. And even what sometimes looks like mild diarrhea can end up being fatal. If there's any blood in the diarrhea at all, then that's an emergency and your dog needs to be seen straight away. So don't allow that to pass for any period of time. You need to ring us straight away. Now, if you have any concern at all about anything, if your dog shows diarrhea and if you've got any concern at all, please give us a ring immediately and bring your pet in ASAP. I've got some scenarios now that I'd like to talk to you about, and in these situations, if the diarrhea doesn't clean up or clear up on its own within 1 day at the most, you must bring your dog in. So you've got 1 day of leeway, and if these situations we're going to mention now haven't cleared up, you must bring your dog in. The first situation is a soft stool, no visible blood, no visible mucus. Now that might be totally consistent with a dietary indiscretion or a dietary change. However, it can also mean the presence of severe parasites like Giardia, which can be fatal in a matter of 24, 36, 48 hours. The second situation is a greasy looking stool. Now this can be a sign of having eaten a whole heap of fat or a very fatty diet, but it can also mean pancreatitis, which can be fatal again in 12 to 24 hours. Now, pancreatitis is inflammation of the bowel and inflammation of the pancreas, my apologies, and it's extremely life-threatening. We've actually got a doggy with pancreatitis in hospital as we're recording this. Now, a black tarry stool means bleeding. So let me explain this. So if you've got bleeding from the last 30 to 40 centimetres of the intestine, the blood will come out bright red. If you've got bleeding from the stomach or the small intestine acts as a cement mixer. And as that blood mixes through the food that's going down the small intestine, that blood becomes tarry or black. So black tarry stool typically indicates the presence of bleeding somewhere higher up in the dog's digestive system. It can be a sign of injury to the gastrointestinal tract from indiscriminate eating. It can also be a sign of a serious disease like cancer. It can also be the sign of a serious disease like stomach ulcers or duodenal ulcers. Next comes watery diarrhea. It can be a sign of stress. It can be a sign of viral incidents like parvovirus or coronavirus. It can also be a sign of parasites, worms. And watery diarrhea very, very, very quickly leads to dehydration, especially in puppies. And here in Australia, in summer, your dog can dehydrate in a matter of 8 to 12 hours. So be really careful with watery diarrhea. Next we get to a soft stool which contains mucus or is coated with mucus. Typically that will be parvovirus or parasites or colitis. Next, a soft or watery stool with visible worms. Well, we've given that one away, haven't we? So a soft watery stool with worms in it or any other uninvited guest means parasites, and you need to worm your dog. And if the diarrhea doesn't stop very quickly, then you need to bring your dog in. A firm stool or a runny poop containing blood or blood clots, as I said earlier, almost always means a serious health problem requiring immediate attention. Fresh blood means current bleeding from low in the intestine, from the colon. as I said, typically from the large intestine. And this could be colitis, it could be perforation of the bowel, it could be damage to the intestinal wall from something that the dog's eaten, it could be cancer, it could be ulcers if I hadn't said that already. So there's lots of things, and it's quite dangerous. Now let's change gears and talk about common and not so common diarrhea symptoms. Diarrhea symptoms can be quite varied. So you normally have frequency, in other words, the dog poos a lot. Urgency, in other words, the dog can't even get out of the lounge room. And loose, watery stools. They're the classic signs of diarrhea. But actually, so is straining. Many dog parents mistake diarrhea for constipation, or constipation for the diarrhea. They see their dog straining and they think their dog is constipated when it's actually got diarrhea. So straining is important, needs to come in quite urgently. Now, what looks like constipation is really just another sign the pet is having a bout of diarrhea. The straining is just another sign of diarrhea. Diarrhea upsets the normal rhythmic contractions of the gastrointestinal tract, and therefore the dog has this weird feeling in its gut and feels a constant need to eliminate. So if you see your dog hunched up outside, check around for loose stools, and if there are loose stools, you've got the answer. If there's no stools, then it may be constipation. But either way, come in to see us. Now, a dog is a lot more likely to have, just as a side note, diarrhea is a lot more common than constipation. The most common cause of constipation that we see is cooked bones. We've been through this before. Never give your dog cooked bones. Other symptoms that can go along with diarrhea include lethargy, loss of appetite, fever and dehydration. Typically young, healthy dogs will have a single episode of a loose stool or loose diarrhea, and it's done, over and done with, fini, and that's all okay. If your dog is having chronic bouts of diarrhea, then your dog is going to run the risk of becoming debilitated and very ill. So again, need to come in. Puppies, small breeds and older dogs are at the highest risk of becoming dehydrated from as much, from just a single episode of diarrhea, again, especially in summer. If your dog seems fine and healthy after a bout of diarrhea, it may be safe to just keep an eye on your dog. But if you notice any lethargy or not eating or any change in behaviour, you need to call us straight away. If your dog seems fine otherwise, but is having recurring episodes of diarrhea that aren't getting better, even if you've done a 12-hour fast and a bland diet, or if there is an episode of diarrhea that lasts longer than 3 days, it is time to call us for an appointment. And needless to say, if your dog is passing blood in his or her stools, or if you notice any weakness or not eating or lethargy or weight loss, then it's also really important to come in and see us urgently. And when you come in, bring in a sample of diarrhea. It's really important for us to have a look at it. Or if you don't want to touch it, and I can totally understand that, then you've got a phone, just take a picture. Now, if your dog is otherwise healthy and his or her diarrhea and his or her behaviour is normal, then my recommendation is just to withhold food, not water, just food, as we said earlier, for about 12 hours, but no more than 12 hours, just 12 hours. A short-term fast gives the gut a chance to rest and repair and restore itself. Follow that 12-hour fast with a bland diet. I recommend you buy a commercial bland diet. And the one I recommend is a product called Hill's Prescription ID. I cannot recommend home-cooked bland diets. They are a terrible cause of problems in dogs. We see so many people giving dogs rice and other things like that, and it's really inappropriate. So I'm going to suggest that home cooking is out, and if you want to do some home cooking, then I'm going to suggest that you do fat-free ground turkey, fat-free ground turkey, and canned pumpkin, or you can even do fresh pumpkin if you can. So ground turkey and pumpkin. If you can't use either of those, then you can use some sweet potato or cooked white potato. They're acceptable alternatives as well. Now, many veterinarians still recommend a bland diet of ground beef or chicken breast and rice. I just don't agree. Even with the leanest ground beef, you get a high content in fat, which will typically worsen a gastrointestinal upset. And boiling the meat doesn't typically substantially reduce the fat content at all. That's why I recommend fat-free meat for bland diets, and turkey is one of the best. Chicken breast might have less fat, but I can't recommend it, as we've been seeing far too many medical problems related to dogs eating chicken. Rice is a very starchy carbohydrate. That's why I don't like rice. And it also tends to ferment and percolate in the gastrointestinal tract. And it provides a great food source for the bad opportunistic bacteria that live in the gut. Rice often also zips straight through your dog's digestive system, and that will make the diarrhea even worse. So rice is not a good option either. So if that happens, if you give rice and chicken, for example, you're possibly going to make the diarrhea worse, and you're not providing any calories or any nutritional support to that dog. Now, canned 100% pumpkin provides about 80 calories and about 7 grams of fibre per cup, compared to 1 to 2 grams of fibre in a cup of cooked white rice. Now, the soluble fibre in pumpkin coats, lines, soothes the gastrointestinal tract. It is brilliant. It will slow down stomach emptying. It slows down gastric emptying. It slows down the peristaltic waves in the intestine, and it is really brilliant at reversing the bad effects of gut parasites. And now let's talk about electrolyte losses and pumpkin. When animals have diarrhea, they really lose electrolytes at a very rapid rate, again, especially in summer in Australia, including potassium, which puts them at a very severe risk of dehydration. Hypokalemia or low potassium levels can result in cramping, both abdominal and muscle, fatigue, weakness, and also heart rate irregularities. Now, pumpkin happens to be an excellent source of potassium. It has about 500 milligrams of potassium, per cup, and that's a really great potassium supplement. And if there's too much potassium, it just passes out. It doesn't get absorbed at all. So pumpkin is also safe for diabetic pets, much safer than rice for diabetic pets. And most animals love it, including, strangely enough, pussycats. Now, since dogs don't have nutritional requirements for grain, I may be treading on thin ice here, but these grain-based diets that are all the rage at the moment are just not in a dog's best interest. They're not grain eaters. Dogs do not have a nutritional requirement for grain. Therefore, feeding a pro-inflammatory food like rice when they're already, excuse my crazy dogs, so we won't edit this out, we'll leave this in, but I'll start again. Since dogs don't have a nutritional requirement for grain, feeding a pro-inflammatory food like rice when they've already got a gastrointestinal upset is just totally counterintuitive. It's wrong. And then lastly, I didn't know if you knew or not, but rice actually has arsenic in it. Probably not something you want to give your dog very often. So So mix the turkey and the pumpkin 50-50 and feed it to your pet until the diarrhea resolves. If it doesn't resolve in 1 at the most 2 days, then you need to ring up, make an appointment and come in. Now there's a few other treatments that I can suggest that we'll add on or add in. Number 1, I also recommend keeping some slippery elm on hand. Slippery elm is a natural fibre source and works really well, and it helps ease tummy cramps. It's nature's Pepto-Bismol or whatever product you like to call it, because it reduces gastrointestinal inflammation and acts as a non-irritating source of fibre, and it helps bulk up the stool and slow down gut speed and slow down transit time. Give your dog about half a teaspoon of slippery elm per 5 kilos of body weight, or a capsule of slippery elm for about 5 kilos of body weight with every bland meal. I also recommend adding in a good quality probiotic, obviously an animal-specific, probiotic that'll once the stool starts to firm up. In my opinion, probiotics are one of the most important adjuncts that you can help by giving to a dog with diarrhea. Number 2, in addition to slippery elm and the probiotics, many pet parents have had good luck with products like peppermint, fennel, or chamomile. Okay, they're all products that help really well. These are especially helpful for cramping type diarrheas and other gastrointestinal cramping that goes with diarrhea. By the way, peppermint is toxic to cats, so do not give peppermint to cats. With this section here on slippery elm and whatnot, we've been talking specifically about dogs, okay? There are several homeopathic remedies that can be very useful for intermittent diarrhea depending on your dog's specific symptoms. Now, one of those is Nux vomica, then there's Veratrum pedophylium, there's Arsenicum albumin, and then there's China ophrolaceus. Now, I don't use those products very much, so excuse my tongue-tiedness, but I'm sure you know what I mean. Now, so I hope that's given you some insight into diarrhea in dogs and cats to some degree and what to do about it. I've just got to add in one disclaimer. This article, when I wrote this and as I'm talking through it today, it's been written from a general perspective only and is no way designed to diagnose or treat your pet's diarrhea. Please ensure that if your dog has a diarrhea or cat has a diarrhea problem, that you have the problem thoroughly investigated and treated at our practice by our veterinarians. Diarrhea can be quite dangerous, and this information has been of general information only. That being said, I hope it's been really useful to you and that you enjoyed it. See you on the next video.